Mechanism of action, GrünGuard. In recent months, we have experienced relevant health issues worldwide due to the pandemic caused by the SARS-CoV-2 virus and all its variants and mutations that have emerged, which causes an infectious disease that mainly affects the respiratory tract and attacks the general status of the human being. As many of us already know, COVID-19 disease is transmitted mainly through droplets expelled when an infected person coughs, sneezes, or exhales. The virus penetrates the body through the mucous glands present in the eyes, nose, mouth, even in the urinary and digestive tract. The virus latches onto human angiotensin-converting enzymes, ACE2, which allows COVID-19 to cause so many and so diverse symptoms related to vital organs, even death. People with problems or affectations in the skin such as eczema, dryness of different degrees, or who present sclerotic diseases are also at risk of contagion, since some particles carrying the virus can penetrate the body by these means. The formulation of GrünGuard, developed by more than 10 years of research, is composed of cannabinoids that act in a dynamic and active way to attack not only the condition of COVID-19, but against any type of virus and its mutations. It acts as a viral modulator, as an element to decrease the negative effects caused by the virus. GrünGuard can be used in different ways. It can be preventive or prophylactic. It is also used to reduce the harmful effects in people who have been infected or who are in a recovery period after the infectious process, having already elapsed the time that the active condition lasts in the body, which is usually 14 days. The formulation of GrünGuard, when ingested and enters the bloodstream, acts as a smart substance that lodges in fat cells and other organisms located in different parts of the body, as well as in memory neurons, hippocampus, and prefrontal cortex. Cannabinoids move naturally and integrate perfectly into the fatty tissues of the body due to the interaction of the fatty medium with the substance of cannabinoids. When the cannabinoids contained in GrünGuard detect the presence of the virus in the body, they act as the body's natural defense and at the time of impact with the virus, disintegrate its enteric layer, a fatty medium that covers it in its entirety and that represents about 85% of the virus, thus reducing the negative effects caused by the infection. GrünGuard modulates and decreases the effects of the virus, which substantially reduces recovery time. As already mentioned, GrünGuard's treatment as a modulator and viral protector made from CBD has several functions. Its administration as a preventive or prophylactic measure is through the daily intake of 20 drops sublingually. As a way of curing a person who has been infected by the virus and to achieve a better recovery after infection, the administration of GrünGuard is given in two ways: the oral form and the cutaneous form. Orally, this antiviral made from CBD is administered sublingually 5 times a day for a period of 13 days. In addition, an analgesic anti-inflammatory cream is applied at least twice a day, which at the same time is a viral modulator, also made from CBD, and which serves to reduce and relieve the negative effects of joint pain caused by the condition. The substance of GrünGuard, when applied in its cream form, takes 3 seconds to enter the bloodstream, and its beneficial effects occur mainly in the upper airways, which is where the virus affects in greater proportion. The recovery time of an infected patient is 10 to 12 days. There is no negative interaction of GrünGuard with other medicines. There are also no reactions with other products such as antihypertensive, and there is no contradiction or documented adverse effect. GrünGuard works in a complementary way with any other product, therapy, or medical treatment that is currently being consumed. Precautionary notes. The mechanism of action based on treatment tested in patients with different levels of COVID-19 involved Mexico, the United States, and South America. All formulations of GrünGuard are 100% natural and have demonstrated a beneficial effect in the treatment against SARS-CoV-2 virus and the different mutations that have occurred to date. The non-indicated use of this formulation is the responsibility of the patient. For any questions about the treatment, it is recommended to consult with the medical specialists of Green Hippocrates. The cannabis used to prepare GrünGuard formulations is genetically modified to eliminate the psychotropic effect. The formulation does not contain THC. Precautions. Cannabis can be consumed by people under the age of 18 on an exceptional basis. Good results can be expected for the attack of the viruses that cause the condition of COVID-19. It is not recommended for people who have shown a history of hypersensitivity to any type of cannabinoid. All rights reserved. Green Hippocrates, Incorporated, 2021.